About 40 million Americans suffer from either insomnia or sleep apnea or restless leg syndrome. Some of the symptoms of sleep disorders like snoring, for example, which our society a lot of times thinks of as something benign or sort of cute even in some cases, is not really benign. In a lot of cases it could be a sign of something that's more serious and can result into cardiac events like heart attacks, irregular heart rate like atrial fibrillations, heart failure down the road. It can worsen seizures if someone already has seizures. It can increase the risk of stroke, and again, auto accidents. Sleep symptoms are involved in about 30%. A common symptom of sleep disorder is the sense of feeling fatigue, despite getting a reasonable amount of sleep. We spend about 8 hours, about 1/3 of our time sleeping, and if something is going wrong during that time, it will have a huge impact on our daytime function. The Sleep Center at El Camino Hospital is unique in many aspects. It's a very comprehensive program. It's a hospital-based program, and by comprehensive we mean that we treat the wide spectrum of sleep disorder, from the very rare to the most common. And we work individually with every patient. They get one-on-one attention with the physician. It's very patient-centered. We talk to the patient, we'll ask you all kinds of questions, we'll try to understand your circumstances and what's actually bothering you, what your needs are. We look at your healthcare history and see what medications you're on, what diseases you might be suffering from, and we do an examination. And then the next step what we do is a sleep study. And the sleep study will answer a lot of questions, will help us determine how well someone is breathing during their sleep, which is very important. If they're having any apnea, it will also help answer questions whether they have something else happening, whether there's be kicking in their sleep, or there be other abnormalities happening during their sleep that the patient is not aware of. And all the patient has to do is basically sleep. We have a nice environment. It's more like a hotel environment rather than it's a hospital. You won't have the beeping noises and the nurse coming in every 5 minutes to check or anything like that. It's a fairly quiet environment. All you really have to do is come in and sleep. And we'll make sure you're comfortable, and we make sure we get all the data without bothering. There's a whole spectrum of treatment options. This is why we emphasize getting to know the patient individually, getting to know their needs, getting to know their risks, and getting to know what is really standing in the way between them and a good night's sleep. And we will help them to get through the process, whether it's a little bit of weight loss, whether it's getting the right device that they can help them sleep better, or whether it's maybe a small surgery that can be helpful. If you take control of your health, you take control of your sleep, which is about 1/3 of your time on Earth, you will be better off, you'll feel better, and you will only have a positive impact on your overall health.